Right now, somewhere in this country, a stranger is about to switch off a human being. Not metaphorically, literally. They're gonna push a drug into your arm, count backward from 10 with you, and by 7, you're gone. No dreams, no sense of time passing. You blink, and suddenly it's 3 hours later, and someone's telling you it's over. And here's the part that should freak you out a little. The person doing that to you, they don't actually know how it works. Not really. Nobody does. We've used general anesthesia since 1846. That's before the light bulb. Since then, we've split the atom, mapped the entire human genome, put a rover on Mars, and somehow we still can't fully explain how a molecule reaches into your brain, turns off the thing that makes you you. So today, we're going to find out where you actually goes. And it turns out the answer split scientists into two very different camps who don't fully agree with each other. It's not sleep. First, let's kill a myth. Anesthesia is not sleep. People say, "Put me to sleep," and it sticks in your head that way, but it's not even close. Sleep is reversible on its own. Your brain cycles through it, drives it, controls it. Anesthesia is closer to a reversible coma that someone else is steering. Look at the brain waves side by side, and sleep looks like rolling waves. Anesthesia looks almost flat, with weird bursts breaking through, like a radio losing signal. And it's not one switch either. It's 3 separate jobs happening at once. Knock out your consciousness, wipe your memory of the whole thing, and shut down pain and movement. 3 locks, 1 key. Except nobody's totally sure how the key actually works. The old theory that was wrong for 100 years. For most of the last century, the leading theory was almost embarrassingly simple. Scientists noticed that the more fat-soluble a gas was, meaning the easier it dissolved into fatty tissue, the more powerful it was as an anesthetic. That relationship was so consistent, so mathematically clean, that it became gospel. The idea was that anesthetics just dissolved into the fatty membrane of your brain cells and gummed up the works, kind of like grease jamming a machine. This theory ran the show for almost 100 years. Doctors used it to predict dosages. It worked in the sense that the math lined up, but here's the catch. It never actually explained why. It described a pattern. It didn't touch the mechanism. Section 3. Scientists were wrong again. Turns out it's not the fat. It's specific proteins. Anesthetic molecules bind directly to certain receptors on your neurons, especially one called GABA A. And when they lock on, they turn down the volume on communication between brain cells. Think of your brain as a massive phone network. Billions of calls happening every second. Anesthesia doesn't cut the wires. It jams specific switchboards. And here's the weird part. Propofol, ether, xenon, nitrous oxide. Chemically, these drugs barely resemble each other. Some are gases, some are liquids, some don't even look related on a molecular level. But they all land you in the exact same blackout. Different keys, somehow opening the same door. Section 4. The question that actually stumps scientists. Okay, so we know which proteins light up. Great. That still doesn't answer the real question. Knowing which switchboard gets jammed doesn't explain how jamming a switchboard makes a person disappear. That's the part nobody's cracked. There are 2 camps here, and they don't fully agree. Camp 1 says it's about circuits. The thalamus, this little relay hub buried in the middle of your brain, normally passes signals between regions like a switchboard operator. Anesthesia disconnects it, and without that hub relaying traffic, the different parts of your brain basically stop talking to each other. No conversation, no consciousness. Camp 2 is stranger, and honestly, most scientists think it's a long shot. But a small group, backed by some genuinely serious recent research, argues consciousness might come down to quantum activity inside tiny structures called microtubules, sitting inside your neurons. And when researchers gave anesthetic drugs designed to block those specifically, brain activity dropped in a way that's hard to explain with a classical theory alone. It's a minority position, but it hasn't been ruled out. 2 totally different explanations for the same blackout, and nobody's found the deciding evidence yet. Section 5. The part that'll actually mess with you. Here's the twist that changes everything you just heard. In 2026, researchers at Baylor put ultra-precise electrodes into the hippocampus of patients who were fully, deeply unconscious under anesthesia, and they found something nobody expected. Those brains were still processing language, still predicting which word was coming next in a sentence, still learning to recognize new sounds, all while the person was completely under and would remember absolutely none of it afterward. So unconscious doesn't mean off. Something in there was still listening, still working. It just wasn't a you that could report back. Section 6. Why this actually matters. This isn't just a fun brain fact. In rare cases, called anesthesia awareness, patients have been conscious but paralyzed during surgery, aware but unable to move or speak. Terrifying, and part of why researchers are racing to understand this better. And this research reaches further than the operating room. It's shaping how doctors diagnose coma patients who might have more awareness than anyone realizes, and even how scientists are thinking about future brain-computer interfaces. Section 8. The honest answer. So, do we know how anesthesia works? Kind of. We know exactly which buttons to press, we just don't fully know why pressing them turns a person off. It's like knowing exactly which buttons on a remote shut off a TV, without actually understanding how a television works. We didn't solve consciousness, we just found its off switch and got really good at using it. So next time you're lying on that table, watching the mass come toward your face, remember what's actually happening. Somewhere behind your eyes, a switchboard is about to go quiet. A hub is about to stop relaying calls. And maybe, just maybe, some tiny part of you keeps listening the whole time, in a room nobody can find you in.